Of health insurance today on radio, on Lagos Traffic Radio 96.1 FM, the show that educates and brings you the latest information on everything health insurance. This program is brought to you by A-Star Communications Limited, and my name is John Omoaka. Well, last week on the show we discussed the topic understanding common eye conditions, during which our optometrist educated and enlightened us on common conditions of the eyes and how having a health insurance plan can help to, help to have a cost-effective manage eye conditions. Well, we thank you for your calls, your feedback, your inquiries about that episode. We hope you learned one or two lessons. Well, today on the show, we shall be discussing your teeth, your health, a very important topic that promotes the care of our teeth, especially as our mouth, with our mouth in general. And so our guest is an expert in dentistry and oral health, and is right here in the studio to enlighten us on the topic. As the conversation progresses, if you have any questions on the topic, you can call or send a message to our studio telephone lines, and that's 0809 912 0777, or call in on 0915 3877 127, and our experts will definitely answer your questions. You're still on to Health Insurance Today on radio, and joining us in the studio to discuss your teeth, your health, is Dr. Oluwadamilola Aigoro. Well, Dr. Aigoro is a resident doctor in oral and maxillofacial surgery at Lagos University Teaching Hospital, LUTH, here in Lagos. Dr. Aigoro, you're welcome to the show.
Thank you very much. Thank you for having me on the show.
Great. Well, Dr. Aigoro, for the purpose of our listeners, let's start off by asking you this question: dental health or oral health?
All right, thank you. And good evening once again to all our listeners. So that's a very good question, because a lot of people tend to confuse the two. So dental, like we know, kind of just means the teeth. But when we talk about oral health, it encompasses not just the teeth, but every structure you have in the mouth. Wow. And how it affects the physical well-being. And so you have the gums, the tongue, the throat. So oral health entails taking care of all those structures and how those structures impact on our health, and not just the health also, but also our psychosocial well-being, which is very important.
Wow, so it's really so important for us to talk about this, isn't it?
Yes, very important.
So what does it, what impact does it have on our overall health? When you talk about the dental or the oral health, what impact does it have?
Okay, so when you talk about our oral health now, and in terms of the impact on general well-being, so there are so many diseases that could affect the oral cavity, and these diseases might present in diverse ways, and very commonly is pain. And when somebody has pain, that would affect the person's function, chewing, speech, then even daily activities. So school children will be affected. It might affect going to school, your way of life, and things like that. And conditions like malocclusion sometimes even also affect the person's self-esteem and psychosocial well-being also. So it's very important, because in terms of eating, drinking, and all of this, so it's quite important to take care of our oral health.
Wow. I can see the importance of this. But then tell us, Dr. Aigoro, some of the common oral health conditions and their causes for, that health conditions.
Okay, so there are an array of oral conditions, but very commonly, just like a lot of us might have heard, we have dental caries, which is commonly called tooth decay. Then we also have gum diseases, or what we call periodontitis. So it can affect the gums. Then also there are conditions that cause pain in the mouth, like oral ulcers. Then also, even to the further extreme, then we can begin to have like conditions like oral cancer. Then also people tend to present with malocclusion too. So periodontitis, dental caries. Periodontitis is also anything affecting the gums and the structures that are holding the tooth together.
These are really medical terms. You're really schooling us right now. But then, what are the causes for some of those things you mentioned right now? What causes for instance, the gum diseases, the oral cancer, and all of that?
Okay.
Their root cause.
So for dental caries, which is known as tooth decay, usually there are so many factors, but commonly is the being prone to free sugar. So in the mouth, we have bacteria in the mouth that act on this sugar that then causes breakdown of the tooth. So that's usually then there are also other risk factors, but commonly is when you take craking of ketogenic diet. But when it comes to gum diseases, usually poor oral health too. So accumulation of what we call plaque. If you look into some people's teeth, you will see some yellowish substances. So that's an accumulation of plaque and calculus. So once that is not properly taken care of, there's bacteria build up, and these bacteria could end up causing diseases to the gums and the tooth structures. Then for conditions like oral cancer, so people that are prone to smoking, drinking, that have been shown to be heavy risk factors for coming down with such conditions.
Wow, amazing for us to have the knowledge of all of this, the causes of oral health conditions. Now, let's look at Nigeria generally now. Are there reliable data that gives us idea of how many Nigerians suffer from oral health conditions?
Yes, we have very reliable data. Let me just stick to the data from the World Health Organization on their oral health country profile for Nigeria that was released in 2022. Okay. So for that, for dental decay in primary teeth, that's for children, we have a statistics of about 35.5% of children being affected in Nigeria. Then for permanent teeth, that is tooth for people, the adult population, we have a prevalence of about 23.9% of our population being affected. So, and even for periodontal disease, that's like the gum diseases. And for people that are about 15 years and above, we have about 25.1%. So when you look at all these statistics, it shows that about tens to thousands of millions of Nigerians have been affected with oral health conditions.
Wow, this is really, really scary, so to say. But then let's quickly get back to the road and keep our listeners, or better still, motorists who are driving right now, to know what's up on the road. Let's check out this part of town. De Butero, it says, while you descend from CMS Bridge inward of a canal, you have a slow movement, and that's due to market activities and high influx. But immediately after that of a canal, if you're able to maneuver your way towards Eco Bridge, you have it all good by NEPA. Then movement on Eco Bridge by NEPA inward CMS Bridge is not a bad one, and descending from Kati Bridge inward the Butero Market, Leventis, and also through the UB roundabout to connect in and outer Marina is quite pleasant. But it's a slow movement on Broad Street to Akmongbon underneath the bridge to connect Ofi Canal Market. And at this juncture, or at this moment, there's no impediment, while our personnel are very much on ground doing the needful. Health Today, or health insurance today on radio, continues. Well, health insurance today on radio continues, and of course we're back and still letting you know that we're talking about your teeth, your health, and Dr. Oluwadamilola Aigoro is very much in the building to answer your questions as well. Do you have any observation? Do you have any experience as regards your teeth or your oral or your dental, whatever it is that has to do with your mouth? Do where to call. Phone lines are very active, and you can call in right now, 0915-3877-127, or you can send a WhatsApp message to 0809-912-0777. All right, Dr. Igoro, tell us, let's look at, from that statistics, what are what actually mostly affected by this oral health condition? Is it the adults, children, gender also, male and female, who are mostly affected?
Okay, so the affectation would actually depend on the condition that we're talking about. But let's take, for instance, for tooth decay. What we know is that for untreated tooth decay is usually you see that more in primary teeth, that's in children, and like I said before, like about 35.5% compared to the adult population. And so when it comes to the gum diseases and its associating factor like periodontitis, we tend to see it affecting more of males, and some people have said because females tend to want to be more concerned about their well-being, so males might tend to want to neglect their care. So you see about 1 in 4 Nigerians being affected. So then also when it comes to in terms of, so that's like the distribution. So you tend to have more of children coming down with untreated tooth decay compared to the adults.
Gender.
Okay, so in terms of gender, like I said, so for what we have majorly, like in terms of for caries, well, we don't really have for gender, but in terms of periodontal disease, so like affecting the gum and the structures around the gum, so it tends to be more with males than compared to females. Although in some other contexts, you might see it affecting females, like in terms of when women come into menopausal age, pregnancy and stuff like that, might also increase the risk for females to come down with some of these conditions.
Wow. All right. Okay, so if you are listening to us right now, you have issues with your teeth. I think you have an ample opportunity to, let Dr. Igoro help to, resolve that on air. Call in and tell us what you're experiencing with your teeth. All right, your oral health condition generally. You can feel free to call in right now, 0915 3877 127. Or you can send a WhatsApp message to 0809 912 0777. All right, Dr. Igoro, tell us about the risk factors for these conditions. Those conditions you made mention of the other time, the gum and all of that. What are the risk factors for these?
Okay, so just like I said, the risk factors, usually we could, in cases of like dental caries, what's majorly implicated is the intake of what we call free sugar or ketogenic diets. So that would be a very heavy risk factor. Then for conditions like periodontitis, poor oral hygiene, not taking care of your mouth, not seeing the dentist regularly for regular cleaning, you understand? Then also for conditions like oral ulcers or maybe cancers and stuff like that. So we have issues like maybe smoking or intake of alcohol, and also some viruses have also been implicated in some of these conditions also too. So these are some of the risk factors. And also we should not forget there's also the socioeconomic impact also too. So sometimes maybe access to care, then low socioeconomic status also too might affect people from seeking care as at when they should.
Well, that takes us to these questions. Can these factors be prevented or managed?
Yes, very, very correctly. They can be prevented and managed. And we will always advocate for prevention, and because that goes a very, very long way. And so we always would advise that, number one, that you want to avoid taking lifestyle modifications in terms of your diet, then also regular cleaning, regular brushing, and most importantly using fluoride-containing toothpaste, brushing in the morning and lasting at night before you sleep. Then also avoidance of lifestyle like smoking, drinking, things that could predispose to cancerous conditions in the mouth also too.
Well, so if you engage all of this, you will not have teeth or oral health conditions?
Yeah. So this would help reduce coming down with these conditions.
Okay.
So yes.
Wow. So for those who are down with any of those conditions, perhaps the gum and all of that, what treatments would you prescribe for them? Okay, so treatment will depend on the condition, just like we've said. So usually we always start even with we go from the mild to probably more complicated treatment. So imagine someone comes down with tooth maybe with caries. So for tooth decay now, there can be fillings done. Sometimes there's what we call varnish application too, like fluoride varnish application. Then you could, so when the cavities are probably more deep, you could have treatments like root canal therapies. Then also for periodontitis, we could do things like scaling and polishing, and that's the cleaning of the teeth professionally. Then also it's also important for early detection and screening in cases of oral lesions like cancers and stuff like that. So, so depending on the presentation, there are definitely treatment for all of these conditions. Yeah. Wow, that sounds like a good news. Still health insurance today on radio, and I've been having conversation with a very own Dr. Lua Damilola Aigoro, and he's been talking about your health, your teeth, because they say that health indeed is wealth, and when you have teething issues and all of that, it's not a clean bill of health, and that's why this is an opportunity for you to share your thoughts. If you're down with oral health conditions, feel free to call in 0915 3877 127, or you can send a WhatsApp message to 0809 912 0777. Well, Dr. Igoro, there's this common oral health conditions that but you will agree with me that so many people are. Some people are down with mouth odor.
Yeah, that's true.
Do you agree with me?
Yes, that's true.
So, what's the prevention for that, or how can that be managed?
Okay, so in our own field we call it halitosis. That's mouth odor. Many of these conditions that I mentioned before also too could be predisposing factors to mouth odor. So although, yes, we have what we call psychogenic mouth odor in terms of whereby some people think they have mouth odor, but maybe they don't. When they come to see us, we try to educate them. But there are some people that actually have what we call true halitosis, which is true mouth odor. And sometimes it could be as a result of dental caries in the mouth. So then it could also be as a result of some other conditions, periodontitis too, could also predispose as the gum diseases to mouth odor. Then poor oral hygiene also too. When you don't take care of your mouth, when you don't brush when you're supposed to, so that will also predispose to mouth odor. Then also there are other conditions too, like dry mouth, when the person doesn't have enough saliva, because saliva helps in cleaning the mouth. Wow. So conditions like that too could also predispose to mouth odor. But most importantly is poor oral hygiene, not brushing the tongue very well. Some people, when they brush their teeth, they tend to forget brushing the tongue and the back of the tongue.
That's right.
And this will allow for accumulation of dirt and then could predispose to mouth odor too.
Did you just say back of the tongue?
Yeah, so most people don't try to brush all the way to the back.
Okay.
They just brush probably the tip of the tongue. And so there's usually accumulation of dirt on the surfaces of the tongue towards the back.
Wow. That's an exposure there. Well, thank you very much. Let's quickly get back to the road and keep it posted as regards traffic around the Okota Isolo. Now, it says Sele Express towards Mako is all good. Same as the return journey. And the Sele linking the bridge inward journey Jesha is quite encouraging. And we have that applicable on the return journey. The inner part of Nwachukwu Drive to connect Sele is all good. Same as the return journey, Agor Palace Road, both inward and outward journey, Apu Junction. The traffic is quite encouraging. Ibe Road, Akpata, inward journey, Transformer Junction to Ilas Sounder Bridge through the service lane is not a bad one. Likewise, the return journey. Inner part of area carry to Solo Road is all good. Likewise, the return journey. Okay, I find what Paco to Kogberegbe, Ile Ibadan, Ishaga, College, Omonide, Aye, Limca Junction. Inward journey, Lasu Tech roundabout, connecting Daliko Bridge all the way to Palm Avenue. We have a steady moving traffic there, and that's due to Daliko market activities. 5-star, inward Yano Solo, Yano Itire, inward journey Jesha Express. Both the main carriageway and the service lane, they're all good. There is a record of impediment for now, and our personnel are visible doing the needful around or across the corridor. Health insurance today on radio continues, and we're about to running things up. If you can still have the opportunity to call in 0915 3877 127, or you can send a WhatsApp message to 0809 912 0777. All right, Dr. Igoro, as we begin to wrap things up, let's look at this very important area that people will love to know, which is how often should people visit the dentist regularly? How often?
Okay, so that's a very good question. So usually we always preach or advocate that you see your dentist at least twice in a year. So that's every 6 months. But this will also be actually depends. There's also what we call the risk based call. So usually depending on the severity of your the dental conditions that you have, you might need to come in probably more frequently than just in 6 months. Some people might need to come at least every 3 months. So depending on the condition that is being managed. But ideally, everyone should see their dentist at least twice in a year.
Wow, fantastic. So now a lot of people complain about the general high cost when you say they should visit regularly. So well, let's look at the general high cost of medical care, especially the dental care right now. What cost-effective measures would you recommend for Nigerians to manage their dental health?
Okay. So first thing, just like we said, prevention is good. So this would help reduce costs for more advanced treatments. So if you do, like I said before, like visit your dentist regularly, then you clean, do your regular scaling and polishing, this will help cut down on so many other conditions that could come out as a result of poor oral health. But also we have the National Health Insurance Authority Act that also mandates that at least everyone should be under insurance for universal health coverage.
Okay.
So this helps. So once anyone can subscribe to any of the health insurance plans, this also helps to avoid out-of-pocket payments, from which so many of these conditions can then be covered.
All right, Dr. Igoro, can you specify what type of dental care services would you are covered by the health insurance plan?
Okay, so well, it will depend on the particular insurance and also the tier of the package that one is also in. But at least on the basic, most insurance will cover for scaling and polishing, will cover for simple fillings, then for probably taking X-rays. But when it comes to more advanced treatments like root canal therapies or maybe surgical extractions or people that want to get crowns and tending towards more of aesthetic procedures, so some of these conditions are not covered. But the routine scaling and polishing, basic fillings are usually covered by most health insurance plans.
Wow, fantastic. Well, as we wrap up this conversation, Dr. Igoro, what advice do you have for our listeners right now on how to maintain good oral health?
Okay, so I would like to finish by saying that we the dentists, we're your friends and we are out there to just help, because most people, when they think of the dentist, they always think of pain and extractions and just pulling out their tooth. But that's not very correct, because the aim is to help prevent losing your tooth or avoid coming down with oral conditions. So we always advise that, number one, like you said, prevention is good. You want to see your dentist at least twice in a year. You want to make sure you are brushing at least twice in a day, in the morning and lasting a night with a fluoride-containing toothpaste. Then you also want to have lifestyle modifications, like in terms of your diet, in terms of smoking, drinking, things that could predispose to oral conditions like cancer. Then also you want to also seek care early, which is very important. Then also you want to make sure that you also try and enroll for insurance, because this would help cover a lot of treatments so a lot of the basic treatments are actually covered under insurance. So seek insurance and subscribe to an insurance plan, which will help to prevent out-of-pocket payments and reduce costs of treatment of more advanced conditions.
Wow, well said. A wise man said a word is enough for the wise, and you have been a wise man sharing with us the advice on how to, maintain good oral health. On that note, we'd like to say big thank you to Dr. Oluwadamilola Igoro, a resident doctor from the Department of Oral and Maxillofacial Surgery, Lagos University Teaching Hospital, LUTH, for sharing these useful tips of the topic of today, which is your health, your teeth, or better still, your teeth, your health. Well, we'd also like to thank you, you the listener, for tuning in to Health Insurance Today on radio. And of course, and this is brought to you by Acer Communications Limited. We hope you found our discussion today very informative and helpful. And let's let you know that you can actually have access to affordable preventive care and treatment of dental or teeth conditions if you subscribe to a health insurance plan today. If you would like to know how to subscribe to health insurance plans for you, your family, or organization, or you just want to know more about the topic of today, please call or send a message to 0901 538 8634. I say that again, 0901 538 8634. You can also send an email to info@healthinsurancetoday.ng. Once again, info@healthinsurancetoday.ng. Don't forget to tune in next Friday, same time for more information and insights on health insurance. Until then, stay healthy, stay informed.
Really nice. I take it.